Good afternoon and welcome to the health edition of Talk Television. I'm Em Roskowski. Cosmetic and plastic surgery is so hot these days, with television shows like The Swan and Extreme Makeover generating a lot of interest, more interest than ever before. In fact, more than 2 million people in Canada and the United States are expected to go under the knife this year in order to change some aspect of their appearance, from nose jobs to facelifts to breast augmentation, liposuction. Surgery obviously provides the biggest changes, but it is not without its risks. To talk today about cosmetic surgery and what some of those risks may be, but some of the other elements around the aesthetics, around skin care and rejuvenation, I'm joined today by Dr. Lauren Tarshis from the Institute of Cosmetic Surgery. Welcome. It's nice to see you.
Thank you.
How do you react to these shows?
Well, I'm conflicted by it, and I think most of my profession is conflicted by it. I mean, on the positive side, it does allow an opportunity to showcase what we can do surgically.
Yes.
The wonderful transformations that we can create. The negative is that, particularly with the Swan, is that the type of individual who they're profiling for cosmetic surgery is not, at least in my experience, the typical cosmetic surgery patient.
So describe the typical patient in the Swan and how she's different from the women you see.
I've operated on thousands of patients, literally thousands of patients, and the vast majority of patients who come for cosmetic surgery are normal. They have a healthy self-esteem. They want to be a younger and or better looking, more attractive version of themselves. They don't want to be somebody else. If anything, they don't use the word extreme, they use the word natural. So I think that the type of individual that they're profiling seems to be an individual who wants to be somebody else. They want to be transformed into a different individual. And that certainly is not a typical individual who seeks cosmetic surgery. These are people, I think, who have a lot of self-esteem issues that surgery may not resolve completely.
But do you have patients who come to you asking you for extraordinary changes? Do you then say, you as a patient? Do you then reject them as potential patients because their expectations are unrealistic or they're maybe unhealthy?
Well, I mean, realistic expectations are the sine qua non of a candidate who's suitable for surgery. I can do the most wonderful procedure, but if the individual isn't satisfied with it because their expectations are just not realistic ones, then the surgery was a failure. So I think people can be transformed remarkably well and still have realistic expectations. That may be doable for them. But the self-esteem issues really concern me, and the aspects of wanting to be somebody else, of being so dissatisfied with your appearance that you want to transform it into somebody else's appearance. And
there's a competitive aspect to the Swan as well, which is a whole other element of the program. One of the expectations that some of these television shows also may raise, and I don't know if you come across them in your practice, is that you can do 2 or 3 things at the same time. You can get this done, the breasts done, the nose done, the face done, and liposucked all in the same period of time. Now, is that a realistic expectation? Are they playing with reality? Is it expected? Is it something that actually should be done?
Certainly we can do multiple facial procedures at the same time. Brow lift, eyelid lift, facelift. Those are safe. They're the norm. Okay. I mean, if somebody needs that to create the look and make them look younger and more attractive, then we will do that. There's no statistics that multiple facial procedures increase risk, but there are statistics that if you combine multiple facial procedures with multiple body procedures, that you are then getting into a dangerous territory, and professionally we would advise against that.
You would advise against it. Okay, so tell me then, what are women coming to you for these days? I mean, what is still the procedure that women say, it's time for me to go see Dr. Lauren Tarshis? What is it that men and women, I know that there must be men in your practice as well, is there?
Yes.
Is it a fixed number of men? Do you find that it's like 10 or 5% of your practice?
I would say between 10 and 20%.
10 and 20%. And is that a fixed number of, like you find that there isn't fluctuations, that men are generally that number of your practice and it doesn't change, or it hasn't changed?
Well, I think there's growth on the men's side.
Oh, is there?
But I think the vast majority of certainly in my practice, of patients who come for surgery are female.
Okay.
And the typical individual is somewhere between 45 and 55. They want to look younger. They want to be more attractive. They want their physical appearance to be in sync with how they feel. Mm-hmm. Because they're healthier now than they probably ever been. They watch their diet, they exercise, they do all the things that are right. But genetics are genetics, and
sun exposure is sun exposure.
Sun exposure and stress and all those other things are important. Hormone changes, particularly important for women. So they look in the mirror and they don't see a physical appearance that reflects how they feel, and they want to do something about that. And that's a pretty healthy motivation. They want to be a younger, perhaps more attractive version of themselves. They want to turn the clock back somewhat.
Now, can you tell me what the difference is between cosmetic and plastic surgery?
Cosmetic surgery is a branch of plastic surgery.
Okay.
Plastic surgery really involves cosmetic surgery, taking perfectly normal people and making them better in some way, turning the clock back, removing a bump from the nose, making their eyes, taking the bags away from their eyes, something to that effect. And then there's another branch of plastic surgery, which is reconstructive surgery. A woman who had a breast removed, reconstructed them, cancer of the face, and reconstructed them. So plastic surgery has two forks.
Okay, so one is cosmetic and one is more reconstructive.
That's correct.
Okay. And then there is the non-invasive part.
Right.
Which must be a big part too. The Botox, the fillers, the non-invasive. You don't cut the skin where you can make a difference too.
Non-invasive cosmetic treatments are really helpful. Botox can help wrinkles. Fillers can help lines and folds. Skin care is important. Non-invasive lasers. But generally speaking, they won't make somebody look younger.
No.
Okay. Surgery. There's no such thing as a non-surgical facelift.
Okay, there isn't,
No,
because isn't that advertised?
It's a marketing term.
Okay, so the gold standard for a younger version of yourself is still surgery.
Surgery.
Okay.